Hello, I'm Dr. Greg, and welcome to How to Become a Dentist. This is segment 8. In this segment, we'll be talking about careers in dentistry. And I wanted to put this in because I find that before you go, many students go to dental school, they really don't know what dentistry is all about. Like, of course, you can get into dental school and become a dentist, but what about after that? What about after you graduate? You have a dental license and you have a dental degree, and what's next? Okay, now you could become a general dentist, and that's great. So after 4 years of dental school and you become a dentist and you take your board exam and you pass it and you get your license, you can go out and work with a dentist, or you can open up your own dental practice where you may buy your own or buy an existing practice from a dentist who may be retiring. That's one option. You also can decide to continue your education and become a specialist, like I did. I became a prosthodontist. And just to let you know, most of the specialty programs are at least 2 years of additional training. So if you wanted to become a prosthodontist, there's a prosthodontist specialty, which is basically the specialty of replacing teeth. So the patients that you would see as a prosthodontist are people who have teeth that are broken or missing, and you would actually specialize in restoring their bite, or restoring their function, or restoring their cosmetic appearance. And that could involve false teeth that come in and out, which are dentures, or bridge work, which is false teeth that actually stay in or get cemented in, or dental implants, things like that. That's one of the specialties. Another specialty that you can go into, another field, is orthodontics, which deals with braces. You may deal with patients who come to you who could be kids or adults that have teeth that have shifted or didn't come in straight, and you use the braces to straighten the teeth. That's an orthodontist. And that's very rewarding because patients leave you with maybe not such a good appearance or not being able to chew, and you fix that, and it's very rewarding in many ways for you and for the patient. Then you have the periodontist. You can specialize in periodontics. Periodontists are responsible for taking care of the supporting structures that hold the teeth in, like your gums and the bone around the teeth. And they make sure that the patient is free of disease so that they can keep their teeth. Periodontists also do implants, so that if you happen to have to lose a tooth, the patient can have an implant placed. And an implant is a structure that replaces the root, so you can put a tooth on top of it. So periodontics is a specialty. You also have the specialty of oral surgery. Oral surgeons deal with the teeth in the jaws. If you break a jaw, you may see an oral surgeon who, if a patient has trauma and has a tooth that's broken and really needs to be removed, like wisdom teeth or teeth that have suffered trauma from an accident, you would have to see an oral surgeon. Oral surgeons deal with the whole head and neck structure and can do different kinds of reconstructions and surgeries, and that is a 4-year program. You also have the specialty of endodontics, where a person may have a deep cavity or a tooth that's been traumatized, and the nerve in that tooth, which keeps the tooth alive, is damaged. And so an endodontist actually deals with the inner part of the tooth, which can actually help have the person be able to keep a tooth even though the nerve is damaged. And then there's also the specialty of children's dentists, which is a pedodontics, where you treat children from early ages until they become adults, and all the different things that children need at that age. So there are many things to do. You could also go into academics. You could go back to dental school, become a professor or a lecturer, and give presentations and teach dentistry to students such as yourself. So there's a bright future with dentistry. There's many things to do. You could also go into the specialty of dental public health, which also deals with community issues. Instead of treating patients, you basically treat communities. basically in the area of research, in the area of public safety and things like that. So what I urge you to do is to look at where dentistry can take you. Of course, you want to go to dental school, but after 4 years, you're going to have to make a decision as to where you may want to go. And it's good to be familiar with what those options are as early as possible. Because if you can get excited about something now, then that'll just give you more motivation to do well in dental school. So you always want to look ahead so that the road to get there is more exciting. All right, so thanks for joining, and we hope you will join us on our next